All right, I think we've got just about everyone admitted that's in the waiting room so far, so we'll go ahead and start. Certainly, we may get some others joining here as we go, I'm sure. Um, Happy Healthcare Simulation Week, everybody. I can't believe it's Thursday already. We were just talking and can't believe that we just did this a few days ago and now we're already at the end of the week, so that's fantastic. Um, just to quickly introduce myself, my name is John Alex. I'm one of the planning co-chairs for Healthcare Simulation Week. I'm an emergency physician by training, and I've been involved in healthcare simulation for about the last 12 years. Retired military, which is where I learned most of this craft, and now I'm the medical director for the Riverside Simulation Training Lab in Newport News, Virginia. To give you a little background on what we're doing today, so as co-chairs, we're coming together to discuss how we wanted to approach Sim Week this year. With all of our busy schedules and trying to coordinate things, we realized that there's a lot of very innovative and cool stuff going on in our community, but seldom do we take the time to really pause and reflect and celebrate the many successes that we're all having. And so we shifted focus a little bit from prior years and wanted to really open up an opportunity, a forum for us all to be able to share our stories, to connect and celebrate our successes. And that's really what today is meant to be. So as we're speaking today, feel free to jump in, ask questions, share your own success stories in the chat. And this is really meant to be a low stress collegial environment. So please feel free to ask any questions you have. And we've got some fantastic speakers that are going to be joining us here to share some of their stories and their successes and kind of serve as a starting off point for the rest of us. So without further ado, I'd like to introduce my co-chair, Priscilla.
All right, thank you.
Off to you.
Thank you, John. My name is Priscilla Lowanson. As John said, I'm one of the three co-chairs of the planning committee for the Simulation Week this year. And I am the director of simulation education from the Mount Sinai West Center for Advanced Medical Simulation in New York City. And my background is in 100 years of education and nursing, critical care nursing. So, and today we are very excited to hear and listen from our champion circle presenters. We have Dr. Susanna Kurtz from my own simulation center, and she's going to tell more about herself. She is the medical director of the Center for Advanced Medical Simulation here at Mount Sinai, and she is the associate professor in Division of Pulmonary Critical Care and Sleep Medicine, Icahn School of Medicine in New York City. And our other presenters they're going to co-present, Dr. Suzanne Rose and Bonnie Barty, and they are from the Stanford Center for Learning, Simulation and Learning. They're going to be introducing and talking more about themselves. And of course, we have John DeMaio, who's going again to introduce himself. And so without again further ado, we'd like to start with Dr. Kurtz, and then we'll have Dr. Rose and Belen, and then Dr. John DeMaio. Thank you.
Thanks. Thank you, Priscilla, for the introduction, and welcome everyone to Simulation Week. I'm really happy to be able to share with you today some information about our simulation fellowship at Mount Sinai West. So I am not the fellowship director, but I was the prior fellowship director for about 3 years before I became medical director of our center, which we lovingly refer to as CAMS, the Center for Advanced Medical Simulation. The current fellowship director is James Salonia. He can't be with us today, and Priscilla, of course, is our director of simulation education. So our fellowship was really one of the first simulation fellowship programs in New York City, and we started as early as 2007 with one fellow. It's expanded significantly since then, but it's a 1-year program. It provides experiential learning opportunities to eligible physicians who really just want to improve their, or have a strong interest in simulation. It's educated and trained healthcare professionals to provide quality and safety for patient care in a safe learning environment. Over the year, the 1-year fellowship, the fellowship is able to develop their own curricula, run simulation sessions, learn how to debrief, and implement a scholarly project. They do this all under the guidance and the mentorship of our simulation faculty. And it's a joint collaborative program between the divisions of pulmonary critical care, sleep medicine, internal medicine, and emergency medicine. So more than half of the graduated fellowships have gone on to hold leadership positions in academic medical centers, and they've gone on to be simulation faculty. They've even gone on to be medical directors of their own simulation centers. We fund our fellows so that every fellow has the opportunity to go to Harvard CMS 5-day simulation instructor training course. We have also sent them to the AHA Team Steps Master Training course, and annually IMSH. They have a strong background in research, and we've had as well as quality improvement projects, and we've been able to almost every year have something published or presented at IMSH, and if not at IMSH, then usually one of the national or international conferences. So we've expanded over the years. Again, it started off as one fellow back in 2007. That was usually was an emergency medicine fellow. And we expanded to both critical care fellows and to internal medicine hospitalists. And in 2021, our fellowship was accredited by the Society for Simulation in Healthcare. Because of the success of the simulation fellows, we have opened up a simulation elective to internal medicine residents. You can see that internal medicine residents make up about half of our learners at CAMS, and they get a lot of experience with the simulation fellows, and got lots of requests for a simulation elective from them because of it. And we have had almost 15 to 20 residents per year sign up for a simulation elective. And because of the enormous interest, we've been able to produce a lot of work with those residents. It's really been spearheaded by them. So in the last 3 years, we've had multiple publications, and 2 of our internal medicines residents went on to achieve Blue Ribbon Awards from the Icahn School of Medicine and Mount Sinai, the Institute for Medical Education Research Day. Beyond that, again, we've produced this picture on the right here. I don't know, you can see it, but that is one of our simulation fellow led projects where we back in 2019, the timing is kind of ironic, but in 2019, we worked on a simulation project on proning patients. And at the very end of 2019, it became very prescient that we had lots of newly COVID positive patients who needed to be proned. And that was published by one of our fellows in CHEST. And then another one that was published was worked on was a project on thoracic ultrasound, and that was published in ATS. So this last year alone, we've had 6 abstracts accepted to CHEST, the ATS International Conference. Usually the IM residents create up to 2 to 3 courses per year for their peers. And that's our fellowship, our fellowship director there is James Salonia. He most recently was awarded the James Jones Young Physician Service and Innovation Award, and he really exemplifies our quest for innovation, excellence, and patient safety and improvement in quality care. And unfortunately, he couldn't be with you here today to talk about our fellows and our fellowship program, but he's really taken us, I think, into the next level in the last couple of years here. So.
Dr. Kurtz, that was a great presentation, and I would say certainly a success without question. From 2007 to 2021, and all the fellows that you've trained and all the research that's been produced. So we've got kind of a series of questions that we had thought about asking folks, but one that really I thought about while you were speaking is with someone who's been so successful in a program like this. For those that are maybe starting out a little smaller scale, I'm sure that through the process, you really had to go and advocate for the fellowship and advocate for funding for these separate courses and sending people to conferences. So any thoughts on or suggestions, recommendations for others who are maybe beginning this journey and how to be champions of their success and how to advocate for growing a program like this?
Yeah, I mean, it requires a lot to run a successful program, but I think you have to start small. And back when we started in 2007, again, we had one fellow, and they really learned with the simulation faculty. And with that success of that one fellow who went on to another, academic medical center and became simulation faculty there. And while she was a fellow, she was able to produce some quality QI work that we were able to, show to administration that there is benefit to this, that there is value to this. And I think that's the key to selling yourself and your program, is that there is value here. And so that's when you're looking to budget for your fellowship program, you have to show administration what they're going to get out of this. And so we meet with our administrators at least twice a year, and we always, besides going over just the data of the sim lab and who our learners are and how many hours we put into simulation training, we always talk about our fellows, and we always talk about the projects they are involved in and how they contribute to the hospital and to the hospital's mission of patient safety, and how their work contributes to patient safety. And that's, I think, where the value is that this is hopefully going to translate into an outcome that your administrators are going to see.
That's great, and fantastic point, because we always talk about return on investment, right? Particularly when we're interacting with the C-suite. And I would say the vast majority of us in simulation don't make money for the hospital,
right?
But we save it in so many ways. And then kudos to your team as well. I mean, you're extending that reach beyond your own center as your fellows are going forward to other academic positions. That's just showing that you are growing other professionals in the community. So that's fantastic.
Yeah, thank you.
Thank you so much, Dr. Kurtz. Thank you, John, for that feedback and commentary. So we now move to our second presenters, and they are going to do a joint presentation. That's Dr. Suzanne Rose and Belen Camacho. They're both from Stanford Health Center for Simulation and Learning, and they're going to introduce themselves and tell more about themselves. Thank you. Dr. Rose.
Yes, hello everyone, and welcome from all over the world. I was in the session on Monday. It was really fantastic to see people joining from across the globe. When you hear about our center, I feel like maybe we should have gone first because we're so brand new into simulation, but it's really wonderful to see where it can go. So I'm very excited to start to understand where our future growth could be after listening to Dr. Kurtz's presentation. By way of introduction, I'm Suzanne Rose. I serve as the Executive Director of Research at Stanford Health. We're located in Stamford, Connecticut. I'm also an assistant professor in the Department of Medical Science at Quinnipiac University. The Center for Simulation and Learning, which we call the CSL affectionately, is part of the Department of Research and Discovery, which also includes the Clinical Trials Office, the Office of Grants, and the Office of Academic Research. And it's my pleasure to be here today presenting with our Center for Simulation and Learning team, John DeMeo. He's brand new. He started just last week as the manager for our center. And then one of our simulation champions, Belen Camacho, she's the nurse manager for the Cardiac Cath and Electrophysiology Lab, and she'll be presenting at the end. So we really came up with the idea to provide simulation because we needed high quality education for our healthcare providers, specifically in the areas of high risk, low incident medical emergencies. It's also become a requirement for medical residents to undergo a certain number of simulation hours as part of the ACGME requirements. And we also have a nurse residency program, which has come to rely on the nursing simulation offerings that we're able to provide them. We had very humble beginnings. We started in 2019, was able to buy one high fidelity simulator, which we shoved into a really small storage closet. I was the only one running simulations at that time, and I was able to dedicate about 5, maybe 10 hours a week to simulation. In that first year, we did run 50 simulation events, which was very exciting. In 2020, with more grant support, we were able to purchase 3 more simulators, a high fidelity baby, a birthing mom, and a pediatric child. And when we were on the verge of hiring a full-time manager, I think you're all aware of a major worldwide event that happened in 2020, COVID-19. So there are very different plans that we had to adjust to. And the program really waxed and waned through multiple rounds of COVID-19 as staff was needed in different areas. So even with COVID-19, we provided 68 simulation sessions in 2020 with a dip to 57 in 2021. In 22, we were out of space in our little storage closet. So we were able to take up residency in an old operating room because we built a brand new tower in 2017 with new operating rooms. This space was only accessed through an active construction zone, so a little bit messy and complicated to get there, and we couldn't really hold simulation events there. So really we're made to perform most of our events in situ. We did hire our first full-time employee at that time and continued to offer more sessions. During that time, we also purchased our first dark skin simulator to continue to promote diversity in our trainings. And in 22, we partnered with a virtual reality vendor specializing in healthcare training. And now we include virtual reality training for both of our medical and nurse resident education programs. So now we're finally in a space, after all this time, we have 6 high fidelity simulators, multiple task trainers, and also a virtual reality station in a 9-bed unit. It was the old PACU unit. So no longer living in a construction zone, which is very nice. And we finally have some space to do events. This year, we provided over 250 hours of learning and almost 80 simulation events. Our learners include all members of the healthcare team. We provide a wide variety of events, mock codes. We do BLS refreshers. We provide support to the stroke fair, resuscitation fair, the sepsis fair. We also participate in all of our new nurse and nurse residency orientation events. We also are part of the new resident orientation. We have a really cool escape room activity that we plan for them, and we are part of high-risk education, unit-specific education, and any type of corrective action plan education. And a really unique feature of our simulation program is that we're situated inside the Department of Research and Discovery, and many of our nurses and residents have been able to use simulation as part of research projects, and we now have 2 successful publications on 2 of these projects. So at this point, I'll hand it over to Belen to discuss how she's used the Center for Simulation Learning for her team in the Cath Lab and the outcomes achieved from that simulation and ongoing training efforts. So I'll pass it over to my colleague, Belen.
Hello, everyone. It's nice to be here virtually to see everyone and everyone's faces on their camera. I'm Belen. I am the nurse manager for the Cardiac Cath Lab. I'm also adjunct faculty at Fairfield University, and working with Suzanne and Michelle Segombini has been a pleasure and really a collaborative work environment. Due to Suzanne, Dr. Rose's support, I was able to visit Priscilla and ask some very great questions, and with a spirit of inquiry, I was interested particularly in codes within the hospital and particularly in the perioperative setting, because the procedure areas are a little bit different than the inpatient areas. I came up with a project. I'm currently in school getting a DMP, at Fairfield University, and we're able to come up with a question and use the Center for Simulation for support, and using high fidelity simulation to see what the issues are and how can we potentially in the future standardize some of those mock codes and reality, how that would help the hospital in general. So we performed 9, I believe, simulations over the past few months, and we were able to use not only the cardiac cath lab, but the hospital for special surgery that is currently in Stanford Hospital, the periop areas, and interventional radiology and non-invasive cardiology. So with a truly collaborative environment, we were able to have all of the staff participate and participate in a fully high fidelity mock code, and we were able to have some great outcomes. We are in the process of evaluation and analyzing those outcomes, but to see based on the American Heart Association guidelines, are we able to defibrillate in under 2 minutes? Are we able to assess the airway? Or are we able to really participate and use the medication appropriately across all the periop areas? And each area is slightly different, but the basis are the same. And using the high fidelity simulation, people were really excited and really encouraged to learn in a safe environment. And that's all due to the collaborative efforts of Dr. Rose and Michelle and her whole team. And welcome, John. It's nice to see you virtually. We're open to any questions that you have. And thanks for the opportunity to share. And oh, I'm sorry, I did have a quick photo to share. Hopefully I'll be able to share my screen. If everyone is able to see that, please just give a wiggle.
We can see it. It looks great.
Yes, this was the cath lab team and our high fidelity simulation. Yeah.
Yeah, it seems like everybody's smiling, the smile of the champions. Thank you for sharing, Belen. So we'll move on with John. And then I'm the timekeeper, and so right now we have about 7 more minutes. We would like to ask to join the group to join us in this sharing. Okay, John.
So John actually just started last week.
Oh,
So
okay.
we were able to invite him to join to be part of the event, but he's still.
Oh, he's not presenting. Okay, I'm sorry, John. I
Jumped
put you on the
behind
spot.
first.
Yeah,
You can see the simulation lab behind John.
Yeah, yeah, in action. Yes.
Yeah. So
So-
Dr. Rose Belen, those were great stories. Thank you. I mean, talk about another success, right? Expanding your center from a closet into a dedicated simulation space. I wonder how many other people on the call can relate to that. I think many of us have been there.
Yeah,
So-
let's do a raise of hand.
Yeah. Who started in a closet? All right. Or inherited a simulator that had been in a closet for 20 years. And Belen, code responses are one of the, you talk about the impact on patient safety. Code responses are one of the most high risk events in the hospital. So being able to take a look at that and scrutinize, where we can do better is huge for patient safety. So that's great. John, I know you just joined the team, but we don't want to leave you out. So if there's any first week successes that you've experienced, even if it's just finding your way to the sim lab on the first day, feel free.
Hi, so my name is John DeMayo. I work with Dr. Rose running the Center for Simulation and Learning here at Stanford Health. And we have a beautiful facility. Again, it's a foreign patient care unit, so it's got all the realities that our providers are used to seeing, and so it's a wonderful high fidelity environment. It's been a massive learning curve. I do come from medical education. I spent the last few decades in emergency services, and I've been teaching various levels, multidisciplinary teams for a number of years now. But this is a wonderful environment to teach in. We can greatly impact patient safety and patient outcomes in a really great environment where there's no real risk of hurting patients, and we can really come into and narrow that gap between education and reality, where we can bring our providers to the best level possible and keep working with them. I'm really excited to be here. I'm happy to be a part of the team, and I'm great to see you all. And we're all on the same team out there. Thank you.
Thank you so much, John, for sharing that. And I want, like we say in simulation, I'm really curious to know if anybody else, if you can put it in the chat, what it is, when you hear champion of your success story, what exactly do you mean? And I think those who really presented this morning, you can already tell they're champions. But like sometimes we would use word and we would want to really describe what champions are like. So anybody? Champions of your story, or you can just write in the chat. Yeah.
Yeah, and I'll throw out there, Bonnie asked if anyone's working directly with patient safety or just responding to events that have been brought to the SimLab's attention. I can speak to that a little bit. I think it's hard for a lot of SimLabs to get a seat at the table with quality and patient safety, but once you do, I think people realize what a benefit it is. So I think typically we start out as, something happened, maybe there's an opportunity for improvement. Hey, let's come to the SimLab and work through it. And that might be the door opening to more collaboration and being on committees and helping think through these things proactively as opposed to reactively.
John, I can share. So fortunately, we report directly up to the Senior VP of Quality. And so I have an inroads right to that. But we really found that by engaging our quality team, we did a huge virtual reality training session for them. So we had them in the headsets. We did a pretty easy scenario. Though most of the members of the risk management team and quality team are nurses by training. So they have been our best friends and in our back pocket ever since then, because they saw the power of just a simple 20-minute virtual reality training session. And they brought us back again to say, hey, can we do another one? That was so much fun for them. Now it's almost like a team building event, because they're giggling at the way other people are reacting. And we'll be having, now that we have our new space, we'll be having a big open house to hopefully have other people come in and see what we're able to offer.
Thank you, Suzanne, for sharing that. And we have just 2 minutes. And so I will ask my co-chair to wrap up. And it's really a very short thing for just to tell the whole success story. And maybe next year we will have 8 hours of this. Okay, back to you, John. Okay.
All right, thanks, Priscilla. Yeah. So again, thank you everybody for coming and sharing your stories and taking part. As a champion of our success, I think this has been hugely beneficial for everyone who's joined. I think it's been beneficial for me. So I really appreciate you all taking the time. It did go very quick. It went quick on Monday when we did it. And so we'll take that back when we plan for next year and see what we can do to maybe open it up a little bit longer. But any closing thoughts, anyone from the group? I would like to thank our participants, obviously, our speakers. We really appreciate your time and sharing your busy schedules with us.
Thank
And
you
with that,
all. And
thank you all.
so now we're going to conclude our Champions Circle of Success, but it's never is an ending and conclusion. It's a very dynamic process, and we would love to hear from you again. So thank you, and have a wonderful rest of the day.
Thank you, everyone.
Thank you.
Happy Sim Week.
Happy Sim Week. Okay.